Medicare, a program created under the leadership of President Johnson under Title 18 of the Social Security Act, is a federal health insurance program for all people 65 and older. Today, Medicare covers over 50 million Americans and has expanded to cover people with disabilities. Before the creation of Medicare, approximately 65% of those over the age of 65 had health insurance. Coverage was often unavailable or unaffordable to the rest because older adults paid more than 3 times as much for health insurance than younger people. Since the creation of Medicare, many provisions and changes have been made, most recently being the Affordable Health Care Act in 2010.
Today, after all the votes have been tallied, health insurance reform becomes law in the United States of America. In a few moments, when I sign this bill, all of the overheated rhetoric over reform will finally confront the reality of reform.
Medicare involves 4 parts: A, B, C, and D. Part A is automatic for anyone over the age of 65 and includes hospital services. However, many people under Medicare find that Part A does not cover all of their needs and pay for optional premiums. Part B is an optional program where people pay a monthly premium to cover physician visits, flu shots, etc. Part C is also called Medicare Advantage, where citizens can enroll in a private insurance company that covers what Medicare does not. Ann Cannon of Florida has Medicare as well as private insurance company.
You could not just be on Medicare. No. It's not, it doesn't pay enough for anybody to just be on Medicare. You have to have a supplement plan.
One of the biggest issues that concerns Ann, who struggles with diabetes, is Part D of the Medicare program. Part D covers drug costs for many Americans. Part D enrollees pay a deductible at the beginning of the fiscal year and enter the initial coverage period where they pay 25% of the cost of their drugs. However, once their costs reach $3,000 for the year, they enter the coverage gap, where they pay between 50 to 80% of the cost. Only catastrophic illnesses where costs hit the $7,000 limit get almost full coverage by Medicare. And, as well as 22% of the Part D enrollees, are stuck in the coverage gap and struggle to pay for their medications, since most Medicare users are retired and are on a fixed income.
My biggest concern with them is the gap for medication. It's not a large enough amount, and most people like myself who are on 10, 11, 12 medications a month reach their gap early, and then the medicines double and triple in price, and we can't afford them.
Medicare is one of the biggest issues of our generation and makes up for 16% of the federal budget. It is also one of the biggest drivers of our national debt. Medicare is an increasing economic obstacle, and Republicans and Democrats have opposing ideas to reduce the national debt without reducing Medicare. To fund President Obama's Affordable Care Act, the Democrat-led Congress passed a provision to cut $200 billion out of the Medicare Advantage program.
Well, you don't have to have cuts in those initiatives in order to reduce cost there. And we have proven that we're willing to make cuts in the cost to initiatives. We took $500 billion out of Medicare in the Affordable Care Act, the health care bill, already.
It can be a winning issue for you. How? Absolutely. Because we're the ones who are offering a plan to save Medicare, to protect Medicare, to strengthen Medicare. We're the ones who are not raiding Medicare to pay for Obamacare.
Democrats support cuts to Medicare Advantage, saying that Medicare Advantage provides extra perks like gym memberships and free eyeglasses. In the 2014 House Republican budget plan, Paul Ryan also proposed cuts to hospitals, Medicare Advantage programs, and other healthcare providers. The Republicans argue that they are using the money from cuts to reduce the deficit, while the Democrats have cut Medicare in order to fund the Obama health program. Though the majority of government officials do not believe that Medicare should be cut to reduce the deficit, both sides are still making massive cuts to Medicare, which is against the public opinion.
The main point that I want to make, and I make this as a member of the Budget Conference Committee, is the American people, regardless of their political persuasion, Democrat, Republican, independent, conservative, progressive, whatever, the American people are quite united in stating that they do not want cuts to Social Security, Medicare, and Medicaid, and they do not believe that we should balance the budget on the backs of some of the most vulnerable people in this country. According to the latest National Journal, United Technologies poll, 81% of the American people do not want to cut Medicare benefits at all. 76% of the American people do not want to cut Social Security benefits at all. 60% of the American people do not want to cut Medicaid benefits at all.
Instead of the government saying that they should work together, they need to work together on the issue of Medicare. A bipartisan committee needs to look for other ways to reduce costs and the overall deficit, like requiring drug companies to give the government a better deal on medicine, or requiring only high-income seniors to pay high premiums, without making direct cuts to Medicare. Part D also needs to be addressed. 22% of Part D enrollees are stuck in the coverage gap, where they have to pay nearly double or triple the price of their medicine, which is difficult on a fixed income. Congress needs to close the coverage gap in order for senior citizens such as Anne to be able to pay for their medicine. We as a country need to come together, despite our differences, to help our fellow Americans receive the proper care that they deserve.